Hi everyone. Thank you for allowing me to present today on a protocol for developing a shuttle service in rural communities. First, I would like to acknowledge all members of the research team who made this work possible and the staff of the Gravelberg Cares shuttle service who we've collaborated with to evaluate their shuttle. Over the next 15 minutes, I will address the objectives listed on the slide by providing some background information on why and how the Gravelberg Cares shuttle service was developed, the methods used to evaluate the shuttle, preliminary findings as the study is still underway, and conclusions based on findings to date. In Saskatchewan, 30% of residents live in rural communities, and in these communities, there are higher rates of older adults with chronic diseases, such as cognitive impairment and dementia, that can affect the ability to drive and lead to driving cessation. This can result in restricted social activities such as fewer contacts or isolation, as well as a reduced quality of life, such as experiencing depression. And these issues can be further enhanced in communities where alternative transportation options are not available. Recently, a study showed that over 50% of rural communities of Saskatchewan had no transportation options whatsoever. In addition, transportation services that have operated in these communities are now closed. Some examples of these services include the Saskatchewan Transportation Company and the Greyhound Coach services. Furthermore, young family members tend to move to urban locations, and so they are less able to support their loved ones who may no longer drive but need help getting around to run errands such as going to appointments. Overall, these difficulties can limit residents from accessing essential healthcare services. To address this problem, in 2019, the rural community of Gravelberg initiated and developed the Gravelberg Cares shuttle service, which is a volunteer community-based transportation shuttle for residents to travel and access healthcare. The volunteer staff included 2 directors, 2 dispatchers, 6 drivers, 1 accountant, and 1 lawyer. And to get the shuttle service in operation, they fundraised enough money to purchase an accessibility van and registered the service as a charitable organization. Originally, the intended operation of the shuttle service included providing door-to-door service for residents of Gravelberg. From Gravelberg, the shuttle would run 2 trips per week, 1 to Moose Jaw and 1 to Regina. Ideally, physicians in Moose Jaw and Regina would agree to see residents on shuttle operation days, and those who used the shuttle would make donations at their discretion, which would support ongoing yearly costs, such as insurance, administration, parking, gas, and maintenance fees. As this shuttle service is the first of its kind in Saskatchewan, we are evaluating it through asking these key questions. Is the shuttle service operating as intended? Is the shuttle service viable long-term, and is it scalable to other communities in need of transportation alternatives? Furthermore, do users of the shuttle service benefit from increased social interaction and community engagement from having used the service? The evaluation includes 3 objectives. Objective 1 is to develop a program model on the creation, implementation, and operation of the Gravelberg Cares shuttle service. The model will provide information on how the contributions, resources, investments, and products and services delivered contribute to the shuttle's desired goals. This information will be obtained through a document review and through interviewing the program staff on the development and implementation phases of the service, and study findings will aid in future evaluation planning. Objective 2 is to test if the Gravelberg Care shuttle service is operating and delivering results as intended. This will be done through analyzing information about the shuttle riders' demographics, such as age and gender, as well as through administering exit surveys on the quality, satisfaction, and alternative options to using the shuttle for riders to complete every time they use their service. Lastly, We will also interview residents on the satisfaction, well-being, quality of life, and social relations of the service. Study findings for this objective will address strengths, weaknesses, and unintended outcomes of the service, which will aid in making recommendations to improve program success. Lastly, Objective 3 is to perform a cost analysis to estimate the financial sustainability of the service over a 5-year period. For this presentation, we will discuss the preliminary results of the document review in Objective 1. Preliminary findings show that since 2019, the shuttle service has expanded in size. Particularly, there's an additional director, dispatcher, and 3 more drivers in 2021. The growth in staff may reflect the increased interest in community members volunteering for the service, as well as the increased demand for volunteers needed due to residents using the service. The directors work an average 1.5 hours a day, and some of their activities include holding regular meetings to discuss logistics of the service or ideas and fundraisers and goals. The directors also coordinate schedules for dispatchers and drivers, create reports documenting rider information or summaries of shuttle use, and they also coordinate fundraisers and create and distribute marketing materials such as the pictures displayed on this slide. The dispatchers work an average of 1 hour per day, and some of their activities include scheduling appointments with residents who want to use the service. During scheduling appointments, they collect information such as the date of appointment needed, address to be picked up, address and time of where they need to go, whether they need assistance getting on or off the shuttle, and whether they have a companion or child traveling with them. The dispatchers also send reminders of scheduled appointments to residents, and they also return missed calls within a 24-hour time frame. The drivers work on a trip basis, so on average they work about 6 hours for every trip. Some of the activities include picking up the shuttle riders with the address provided on the information sheet collected by the dispatchers, and those are for residents in Gravelburg. For residents in other communities, the drivers will pick residents up at city junctions, so the residents will meet them there. The drivers transport riders to the destinations, and they're responsible for shuttle maintenance, such as fueling the shuttle for trips. Within the first 7 months of shuttle operation, from June to December 2019, there's been 55 riders who've used the shuttle, and the shuttle has made 35 trips, so this makes an average of 1 or 2 riders per trip. 40 or 73% of riders have used the shuttle for medical transport, whereas 15 or 27% have used it for wellness trips. And wellness trips include traveling to attend special or social events or visit family on holidays. In 2020, the shuttle operated full-time for 8 months. The service operated for 2 weeks in March and then was closed due to the COVID-19 pandemic restrictions until mid-June, which you can see a difference in the number of riders during those months. Overall, 106 residents took the shuttle, and there were 88 trips, making an average of 1 to 2 riders per trip. 94 or 89% used the shuttle for medical transport, and 12 or 11% used it for wellness trips. From June 2020 onwards, the wellness trip numbers are affected because after the service was reinstated in June, the shuttle service was used solely for medical transport. Between January and July 2021, the shuttle operated full-time for 7 months. Similar to 2020, the service was affected by the COVID-19 pandemic restrictions from March to June. Overall, 53 residents took the shuttle, and they were all sole passengers, so there were 53 trips. And this year, the 100% of riders used the shuttle for medical transport. In total, there's been 214 riders who have used the shuttle, and 176 trips, which make an average of 1 to 2 riders per trip. 187 or 87% of the riders have used the shuttle for medical transport, while 27 or 13% have used the service for wellness trips. As shown in the green figure, most residents who use the shuttle reside in Gravelburg, but there are residents who reside in other rural communities, which shows that there is a need for the shuttle service in other rural communities of Saskatchewan. As shown in the yellow figure, most residents take the shuttle, transport it to Moose Jaw or Regina, but again, some have taken the shuttle to other locations around Saskatchewan. Some of the operational goals were to pursue a wheelchair ramp and receive support from provincial government involvement, whereas outcomes that have been achieved included getting van storage and setting fees for transporting passengers solely between Moose Jaw and Regina or vice versa, as well as providing transportation for other reasons besides medical transport. So, for example, the mental health and wellness trips. When comparing the initial intended operation with the actual operation of the shuttle service, the service provides door-to-door service for residents in Gravelburg, but in other communities, the shuttle meets residents at city junctions. Rather than running twice a week to Moose Jaw and Regina, the shuttle service has ran between 1 and 5 times per week and goes to Moose Jaw and Regina, as well as Assiniboia, Gravelburg, and Swift Current. Furthermore, rather than physicians agreeing to see Gravelburg residents on shuttle operation days, the shuttle runs are booked on a client needs basis. For the most part, riders make donations at the discretion, which support ongoing yearly costs. However, certain scheduled rides, such as traveling solely between Moose Jaw and Regina, have set fees. To summarize today's session, the Gravelburg Care Shuttle Service was developed to address the concern of limited alternative transportation options available in rural communities of Saskatchewan. The development involved the initiation from a group of volunteers in Gravelburg with an intended vision to provide residents with a transportation service to Moose Jaw and Regina to access healthcare services, as well as other excursions like mental health and wellness trips. Our preliminary findings of a document review show that operating the shuttle requires daily volunteer commitment from the directors, dispatchers, and drivers, as well as regular planning and management to discuss, revise, and adapt intended goals with actual outcomes. Building on our evaluation of the shuttle service will include developing a program model through updating the document review for the entire year of 2021, and interviewing the program staff on the development and implementation phases of the service, testing if the service is operating and delivering as intended through analyzing rider demographic information and through exploring residents' perceptions on the quality, satisfaction, well-being, and social relations of the shuttle, and lastly, through estimating the financial sustainability of the service through performing a cost analysis. Thank you very much.